You know, every single day, with every breath we take, we're pulling in more than just air. There's this invisible threat that connects the entire planet's climate to what's happening deep inside our own lungs. Okay, let's get right into it and explore this really dangerous link between climate change, pollution, and our health.
So to really get a sense of what we're up against, let's just start with a number: 6.7 million. According to the World Health Organization, that's how many premature deaths are caused by air pollution every single year. That's something like 12% of all deaths around the globe. This isn't some far-off problem. It's a massive public health crisis that's happening right now.
And this is where we get to the core of the issue. We have this habit of talking about climate change over here and air pollution over there as if they're two totally separate problems. But the research is crystal clear. They're not. They are a combined force. As this image from our source material shows, these two crises are working together, and our respiratory health is caught right in the middle.
So how exactly does that work? Well, it's not a simple cause and effect thing. It's much more complicated. They're actually locked together in what you could call a vicious cycle. So let's break down how one of these problems actually fuels the other.
You know, this quote from the scientific review we're looking at today just says it all perfectly. They are intimately intertwined. This isn't just a coincidence. Climate change doesn't just happen to exist at the same time as air pollution. It actually makes it worse. It amplifies its effects. And, as we'll see, sometimes it even works the other way around.
Okay, so this feedback loop is really the key to understanding the whole thing. Let's walk through it. First, climate change dials up the intensity of extreme weather. We're talking bigger heat waves, stronger storms, more intense wildfires. Step 2, all that extreme weather actually makes air pollution worse. Wildfires pump smoke and particulate matter into the air, and heat waves literally bake pollutants. And then finally, some of those pollutants can turn around and make climate change even worse. You see, it's a cycle that just keeps feeding on itself.
And this is a perfect example of what I'm talking about. A heat wave is more than just hot weather. It's like a giant chemical oven in our atmosphere. All that heat and sunlight takes other pollutants already in the air and cooks them into something even worse: ground-level ozone. And the effect is huge. Studies have shown this can jack up ozone levels by a staggering 28%.
So, we've looked at the big, planetary picture. But now, let's zoom all the way in. Let's make this personal. What is all this stuff actually doing once it gets inside our bodies? Specifically, inside our lungs. The main culprit here is a process called oxidative stress. Now that sounds complicated, but the easiest way to think about it is like your insides are, well, rusting. When these pollutants get into your lungs, they create these tiny, unstable molecules that just start wrecking things, damaging your cells, your DNA, your lung tissue. It's what triggers inflammation and makes it harder for your body to fight back. And the results of that damage, they're just devastating. Take asthma. It's a condition that now leads to about 400,000 deaths across the globe every year. For someone with asthma, breathing in polluted air isn't just annoying. It can trigger a severe attack, land them in the hospital, and make their symptoms so much worse.
And it's not just asthma, not by a long shot. In 2019 alone, another lung condition, COPD, or chronic obstructive pulmonary disease, was responsible for over 3 million deaths globally. And the research draws a really clear line connecting long-term exposure to air pollution with getting and worsening this terrible condition.
You might think it takes a huge, smoggy day to really see an effect, but the data tells a different story. One study found that even a small increase in what's called PM₂.₅, that's the really tiny, nasty stuff from smoke and exhaust, can raise a child's risk of developing asthma by 14%. I mean, these aren't just abstract numbers. This is about the real, long-term health of our kids.
This chart kind of helps us see those risks side by side. So there's that 14% increased risk for childhood asthma from PM₂.₅ we just talked about. But look, the same pollutant increases the risk for allergic rhinitis, hay fever, by 15%. And even nitrogen dioxide, which mostly comes from traffic, bumps up the risk for COPD. Every pollutant brings its own unique threat to the table.
Now here's a really important point. While polluted air is bad for everyone, it doesn't affect everyone equally. The health burden from this toxic mix falls way more heavily on certain groups of people. So who is most at risk?
The research consistently points to 3 groups that are especially vulnerable. First up, children, because their lungs are literally still under construction. Second, older adults, whose lung defenses might be starting to decline. And third, really anyone who's already dealing with a chronic health condition, especially something like asthma or COPD.
Let's just focus on kids for a second. Their respiratory systems are still growing, and they actually breathe in more air for their size than adults do. So when they're exposed to pollution at a young age, it's not just about getting sick for a few days. It can actually change the course of their health, setting them up for a lifetime of respiratory issues and a higher risk of diseases like asthma and COPD.
Now, for older adults, it's a different situation, but just as serious. As we get older, our lung function naturally starts to decline a bit, and our immune systems aren't always as tough as they used to be. This just makes them more sensitive to the damage from pollutants, which can speed up that decline and make them much sicker from respiratory infections.
And of course, for the millions of people who are already living with a condition like asthma or COPD, air pollution is like throwing gasoline on a fire. It doesn't just annoy them, it makes their disease actively worse. It can mean more frequent and more severe attacks, a faster decline in their lung function, and more trips to the hospital.
Okay, so we get it. The problem is huge, but just understanding it is the first step. The next and most important step is figuring out what we do about it. The research is clear that we have to do something. So how do we start to break this vicious cycle we've been talking about? The strategy really comes down to two big ideas: mitigation and adaptation. Think of it like offense and defense. Mitigation is our offense. It's about tackling the problem at its source. That means cutting greenhouse gas emissions and promoting clean energy. Adaptation is our defense. It's about managing the health problems that are already here, protecting people right now with things like better air quality monitoring, early warning systems, and making sure everyone can get the healthcare they need. We absolutely need to do both. Now, if we're going to play offense and mitigate this, we have to know where the pollution is actually coming from. This chart gives us a really good breakdown. Look at that. Energy production and agriculture are tied for the #1 spot, each responsible for about a quarter of the problem. Right behind them are industry and transportation. This really shows that cleaning up our air isn't about fixing one thing. It means taking action across a lot of different parts of our economy.
So we're left with this. The science couldn't be clearer. The link between a warming planet, the air we breathe, and the health of our lungs is undeniable. That feedback loop is real, and it's incredibly dangerous. So the real question isn't if we need to act, it's how we're going to come together and finally break this cycle to protect our air and ultimately to protect ourselves.